This is Health UnaBASHed, broadcasting live on Healthcare Now Radio. Health UnaBASHed is where healthcare meets innovation, insight, and impact, where we don't just celebrate progress, we interrogate it. I'm Greg Masters, co-host and executive producer, alongside my partner in conversation, author, editor, and industry steward, Gil Bash. Today's guest is not here to make the system comfortable. Matthew Zachary is a brain cancer survivor, founder of Stupid Cancer, and host of the podcast Out of Patience. For nearly 2 decades, he has challenged the structural blind spots of American healthcare, particularly where autonomy, transparency, and financial incentives collide. Diagnosed as a young concert pianist, Matthew confronted not only cancer, but a paternalistic culture that assumed compliance over conversation. That moment reshaped his life and helped catalyze a national young adult cancer movement built on agency, irreverence, and unapologetic advocacy. Matthew asks uncomfortable questions. Why are patients still commodities? Why does coverage often feel adversarial? And why does trust erode faster than reform evolves? Today, we unpack autonomy, anger, and whether disruption alone can fix what policy has protected. Matthew, welcome. Gil, the mic is yours.
Greg, thank you. I want to thank you again. This is a first for us. We've never done part 1 and part 2. And so after 5 years, I guess, why not venture into new waters, especially when you have an incredible guest like Matthew Zachary. Matthew Zachary, who is the founder of Stupid Cancer, really an activist for many, many years, quite extraordinary. Many people know him for his podcast program, which is very dynamic. I had the privilege of really being on one of his episodes Out of Patience that I think is just phenomenal. I think Matthew does his homework also. When he has a guest on, they should be prepared to be lovingly grilled. And that's what makes it so special. He's real, he's in the game, and everything he does matter. As many of you know, but not all, that Matthew, when he was in college, really an aspiring concert pianist, suddenly felt something strange, some numbness that really was inhibiting his playing power. Diagnosed with brain cancer, treated for brain cancer. Very scary ride. We talked about that last week. That episode is on download on demand because you're listening to the newest radio episode. And from the experience, well, most people would just kind of reboot and go back into their life. Not Matthew. He decided to create a whole movement. He's still at it, by the way. And today we're going to discover chapter 2, very exciting chapter 2. If you've been following him on social media, I highly recommend that you do. You get a glimpse of that. Today we're going to talk a little bit more about that. We're also going to talk about something that is so much a part of his life, his passion about playing piano. So, Matthew, welcome back. This is the first or the second, depending how you want to look at it. And you've got a big event coming up in just a little bit at Merkin Hall, where you're going to step to the stage as a concert pianist, and also in celebration or introduction to a soon-to-be available incredible book, We the Patient. So can you tell us first a little bit about the concert?
Yeah, I'm still pinching myself that I get to do this again. I've just not had the time to figure out when can I get back on the stage for a public. I've done a ton of private events.
I know we bumped into each other at conferences where you say, hey, I've got a gig tonight with a medical group. I'm playing piano and talking a little bit.
Yeah, but I haven't been at a concert hall in 20 years. I haven't given a public concert since 2002 for the American Cancer Society on the National Mall. Ironically, I gave a piano concert to 30,000 people, but I was at Merkin Hall for an event in the 90s, and I remember loving the space and the acoustics. And I think only someone like that's a little N of one like me could say, I'm going to launch a book with a live solo piano concert and a book reading in a 2-hour theatrical experience at Merkin Concert Hall at Lincoln Center. And I'm just like, I'm so happy because I'm rehearsing again and I'm practicing again. I've rented a piano for my studio over here. I'm playing every day. I'm playing my daughter's piano in her bedroom. And I'm reconnecting with who I was 30 years ago. I never lost that spirit and soul, but as any artist who will tell you, there's nothing like being on a stage with the instrument that speaks to your spirit, and it's just you and God making noise in all the right ways on your terms, and the audience just happens to be there. And that's what I'm going to enjoy being. That version of me is coming back very quickly. The muscle memory will take some time, hence why I'm rehearsing. I'll never be as good as I was in my early 20s before I got sick. But I felt like there's no better way to express my gratitude to me, to the universe, to my community, to my friends, and to the general public who likely may have no idea who I am, than to launch a book with a Lincoln Center grade professional piano concert.
It's funny you say that, because in our earlier times when we'd meet at the beginning of our relationship, you talked a lot about your being a concert pianist and aspiring to be a concert pianist during your university period, and even your choice of therapy with I think it was your uncle who was guiding you through the process of physician, and your concern about, sort of having neuropathy or numbness in your fingertips, that he warned you off in terms of certain sort of therapeutic approaches, certain chemo that they wanted to give you that would have an effect, a long-term effect on your body. And so a lot of your decisions, even I could say, you can correct, life and death decisions were based upon preserving that part of your identity as a pianist. And now you're getting a chance to really realize that dream. I mean, it's a celebration of another chapter of your life. And the reason I bring that up, it's not just the playing at Merkin Hall, it's also the introduction of this book that I want people to know that I had the privilege in confidence of reading the manuscript, which I've got to tell everyone, it's a great book. It's raw at times. It's real. It's raw. It's relevant. You touch on a lot of different things. Certainly your life is woven out throughout the book. I discovered things about your health journey that I hadn't known before, including things that are more recent. I also really connected to something that you write about, because you're just being very transparent about the continuous journey, about when something pops up and you're not 100% certain of what it might be. It might be nothing more than, a cold that's making you a little dizzy, and your mind kind of immediately is drawn to what happens if it's returned. What happens if brain cancer is returned? You don't escape from that. You're very real and transparent about that. Everybody has a little bit of that in them, but you're particularly transparent about that. But you also talk about something that's very close to my heart, which is the struggles that you have faced throughout your life in scrambling for sufficient insurance coverage. I mean, at one point when you started your career, the advertising company you were working with, you cited in the book, the insurance didn't cover certain things that were necessary to your specific situation. So you had to carry over COBRA from a previous job and their insurance to make sure that you had that sort of sufficient coverage. I'm not talking about cost coverage. I'm just talking about therapeutic coverage to make sure that you can take care of yourself. And you even talk about the fact of Obamacare, what that might mean to you and other people. How does that play out? You obviously sort of unfortunately got your PhD in insurance coverage from this experience. Would you mind sharing a little bit about that journey with us?
Absolutely, yes. And I try to put everything through this lens, and I feel like when I tell my story, it's a history lesson. It's 30 years of American history baked into how the hell I'm still here.
Maybe injustice and the history of injustice of people who have very serious illnesses that they've got to contend with long periods of time.
Well, I mean, the The story of my Uncle Jay is resonant even 30 years later. I was a concert pianist. I had brain cancer. I had radiation. I had surgery, and the doctors wanted to give me chemotherapy. Side effects would have included deafness and permanent nerve damage in my fingers and toes. That's not something a concert pianist wants as an outcome. I'd rather be dead than not have piano. My uncle brought that to my attention, not the doctors. My uncle happened to be a genomicist. He knew medicine, and he's the one that stepped in and said, "What are you going to give my nephew, my godson?" And then I don't want this crap. I'd rather die in 5 years without this than live 80 without piano. And they were stunned, the doctors, that I chose to not listen to them because I cared about this. That's a through thread 30 years later, that no one asks you what's important to you. First and foremost, the insurance issue. Yes, this was way before ACA allowed you to get insurance at 26. You had to get insurance at 22. And what better time to have cancer than the week before you're 22? That was my spring of 1996. So I had to scrape, my father and I had to scrape together some variant of his plan. And it was insanely expensive. And like you said, I could not accept, I was thrilled to get a job. And I could not accept the policies of the insurance of the employer. No fault to them, but there was no way. This is back when risk pools existed. So we look at Progress. We kind of don't have that now. So shout out to Progress in terms of preventing pre-existing condition and up to 26 years old. But the through thread is still, where is my agency? Where is my autonomy? Where is my ability to make a judgment that's best for me and maybe not what's best for the system, the doctor, and heaven forbid an insurance company says I can't have it.
Yeah, it's terrifying. You have a number of stories. It's not just one story.
Yeah.
I mean, those stories sort of intersect throughout your entire life in the book, where it happens again and again and again, different stages of your life.
Yeah.
But you on one hand, the book is about the N of one. It's about you, but it's easy to see through the book how that's magnified up to many, many people. The title of the book is We the Patients. You have sort of a beginning. It begins with a bit of a manifesto. I won't go into the manifesto. I want the readers to read it when the book is available. But I want to tease it out. We talked last time, and I've written about this, about the assassination of Brian Thompson, the United Healthcare executive, and how a certain segment, albeit small, but present, were very supportive of the act. Down to billboards in cities saying, "Who's next?"
Right.
Currently, he's raised about $1 million in crowdsourced funding for his legal defense. There's a well of empathy for him because of what he's experienced, and you would expect insurance companies to sort of get the message of saying, if reputation is important, I think high reputation gets people to bond you. Low reputation means Congress can rip you to shreds. Why would someone allow their reputation to go lower and lower? Now, in the book, you also talk about this tension between the mission of health insurance and the reality of economics. Patient versus profit. It's a controversial issue because we live in a system that rewards free enterprise.
Yep.
And at the same time, you have people who are desperate and really rely on who's going to pay for this. So I just got a bill from someone sent me without their name on it, but I know who it is. They were 2 days in the emergency room, 2 days in the emergency room. The bill is $66,000. 2 days in the emergency room. The insurance company, they have good insurance. The insurance can be paid $1,876.
Oh, that's fabulous.
Yeah. How does that, do we understand how that's, who makes those decisions? It will be $66,000. I'll pay you $1,800.
Right.
What was your life like during that period when you were really interacting with, I got to stay alive. I've got to determine the right therapy. I'm getting all these bills.
Well, that's a question my dad was interviewed for the book, because this goes back to, dial-up analog dot matrix printing, black and white little Macintosh computers in the basement days. And very gratefully, he knew instinctively to start keeping a journal. back when that was not a thing people knew about. There exists today a Word document from November of 1995 that goes through June of 1996 with my dad annotating every single thing that went on every single day. And the pieces that we culled together around how much insanity he had to go through to deal with catastrophe policies and justifications and fax machines and staying on hold and negotiating this and that and finding there were no advocates back then. There were no organizations that did stuff on your behalf back then. So again, history lesson. My dad army crawled his way through this. And at the end of the day, it probably, again, there's no way to know the numbers. I mean, he kind of remembers loosely. It easily cost us $150,000, $200,000 in the end after millions of, I think it was $46,000. Don't quote me on this, per treatment, per 33, it might have been less. I had 33 treatments of radiation. That alone was multiplied by that. The surgery, the neurosurgeon, the anesthesiologist, the week-long hospital stay. Yes, but this speaks to transparency, which is the jargony term. But I'm fairly sure if your buddy went to a different hospital, the bill would be different for the same exact service.
Just tuning in, you are right on time for Health Unabashed on Healthcare Now Radio. We're speaking today with Matthew Zachary, cancer survivor, founder of Stupid Cancer, and longtime advocate for patient autonomy and systemic reform in American healthcare. We're diving into trust, transparency, and what it will take to move from transactional sick care to person-centered care. Stay with us. There's much more ahead.
I'm positive of it. You know, it's the wacky thing. It's sometimes location. Like if you're in New York City, bill might be higher than it if you're in Arkansas.
Right.
You know, Benningtonville in Arkansas. But still, you know, it's. You know, I talk about this often, like your wonderful shirt. Everybody should, you know, forget about reading Matthew's book. You know, find out where he buys his shirts. But
RobertGraham.com, not a sponsor.
Okay, there you go. The secret is out. They're going to see a huge amount of Matthew Zachary lookalikes on the street.
Right.
Wait to pour them, right, my friend, or Halloween.
Yep.
That's what we're going to see. Look, the reality is that you kind of became an expert. You could have gone in different directions today. Today, there are actually patient advocates who are, you know, experts and hired by other families to help them, well, guide them through the process. It's tough. That's a job. From the book and from your social media posts, I sense that you're at the very beginning of launching a new movement. Stupid Cancer was a very successful movement that you led for many, many years until you stepped away to, you know, give it flight, and also for you to focus on things that were priorities for you. Is We the Patients the evolution of a broader movement of people who are stuck in the health system, struggling to survive or thrive, and need to express themselves?
I think you can consider it my next act. I had a thought experiment about 18 months ago. This is before Trump, before the murder, before all this stuff. I had a thought experiment, which was simply put, if every disenfranchised consumer group in America can get a PAC in 1 hour and do things to threaten electioneering, you know, primarying and whatever, why has there never been, I started in a cancer, why has there never been a cancer lobby? There's been lobbying. There's been Hill Days with pretty pictures and bald kids and senators, but it's all about fighting insurance to cover something. Every single one of those things is fighting insurance to cover something. It's never about we deserve this because it causes harm. And then I started to think about health insurance as infrastructure, as utility. And what would it mean? You get 20 million Americans who are cancer survivors alone. What's the one thing we would want in the law that would happen if we were threatening elections? And like, we don't want to go broke. We want to know shit exists. We don't want to die on hold, right? Those are consumer protections. We look at how it took like 15 years for the airlines to cave, that if you're sitting on the tarmac for 2 hours, you should go back to the gate. You're causing harm. So we, the patients, started as a thought experiment. Just suppose you were to organize the American consumer who has been touched by cancer or other things or just been harmed by health insurance practices, what could that mean to Wall Street? What could that mean to drug development? What would civic power at the ballot mean with the largest potential voter bloc ever made in this country? That's what that came down to. And that is the framework and the path for We the Patients as America's first true patients' rights voter bloc movement.
First of all, it's an incredible concept, and much needed. I know people, as do you, who unfortunately, we have a nation with a disproportionate amount of people who have medical bill bankruptcy. Mm-hmm. It's heartbreaking. It's
2/3 of all bankruptcies are medical, and 2/3 of all medical bankruptcies are oncology.
So data. I mean, there you have it. I think that you're a catalyst. You stir it. You got to ask yourselves, why haven't the major cancer organizations recognized their responsibility to the people they serve by going after this issue head on?
No, it's because they are the system. They're not the bad part of the system, but they become the system.
They feel dependent upon money from different people, and that the financial interests or the transactional interests. I just want to go into the book. There's a lot of vignettes in your book, and I just want to note for readers that the reason you're going to love this book is it's passionate. It's very passionate. It's hard hitting. That's all that Matthew does. I understand that he had to reserve the amount of 4-letter words that were used in the book by his publisher, to express his point of view, but they were used as descriptive adjectives to describe a system that's so broken. Matthew goes into that. Do you mind sharing one of your favorite stories in the book? You have so many. They're powerful. Fortunately, many of us have not been in your situation, but if you've been in a health situation before, you totally identify with this book and with your narrative in the book. Is there a story that you really love that you don't mind sharing with us?
There are so many, but on an absolute personal note, not that my dad and I needed to be more connected. We love each other. It's a fabulous relationship. He's an extraordinary human being. But having to go back and read his journal and figure out how do you editorialize that level of absolute pain and suffering of a father who's 49 watching his 21-year-old son die every single day in the hopes that something good would happen, in writing in a Word document in Times New Roman on a black and white Macintosh. I learned so much from that journal. And I've read it before. I just never really lived it to write a book about it. And the one anecdote in the entire book that I'd completely forgotten about was how the book opens. Apparently, we were stalled on the way to Sloan Kettering because there was a truck in the middle of the road. And my dad just drove up on the fucking sidewalk and nearly barreled over 50 people just to get me to care. What better metaphor is it?
Whatever
about the American
takes,
healthcare system.
Kind of whatever it takes.
Yes.
The love for a father for a son, but also like I'm going to make this happen. I mean that is so incredibly touching. The frustration that comes out of your book is so palpable, and then at the end, it ends clearly with a call to action. You begin the book with a manifesto. As I said, I don't want to go into. I think it is sort of like a mission critical thinking process that rallies people to this. The book is going to come out this year, God willing. Obviously, you're going to have a sellout standing ovation concert that I prophesize with clarity. If we're having the conversation, you're going to come back on the show a third time. I'm sure once the book is out, I want to hear about
I'll be your first part 2 and your first part 3.
But what do you hope to have happen in a year from now?
I want Americans to realize that I'm giving you grace and permission to be pissed, but I want to offer up an opportunity to organize for the first time in a way that's nonviolent, bipartisan, and single issue. And it's not that we deserve X, Y, and Z. Of course, we deserve better from a profit-based system. But you can't throw a profit-based system out of the way. You have to reorganize power and money. And consumer protections that can shield us from the harm until the harm subsides it's the Ralph Nader seatbelt idea. It's time to organize. And once elected officials realize that we are probably 20x the power of the NRA with way more money than the gun manufacturers have behind us, the system will change and bend to the will of the voter. Because I like to say the real revolution happens when patients are in charge of their own outcomes.
Or influence, have a voice in their own outcomes. I just wanted to note, our time draws near.
I mean, it's really civic power. But that's a wonky term. It's civic power.
Patients have to be brought in to the discussion around their care. I look at, first of all, again, I want to thank you for endorsing my book.
Yes.
That just came out. Healing.
You can't see it. It's right over there.
Oh, thank you. Take a picture of yourself and post it with the book, please.
Oh, sure will. Yes.
I really appreciate that. And I'm looking forward to doing the same with your book. But I know that a lot of books have come out right now with related themes. Like your book is touches my book touches your book. There's other books that are coming out that also engage. I don't see this at all as copycat. I think there's a mindset shift that a group of us like yourself feel we've got to add our voice to the conversation now. We can't sit on the sidelines. What do you think? Do you think that this is a sea change in the mindset of the American public?
I think it's the country's in more pain than ever because of healthcare. Yes, there's a lot of noise. There's always going to be a lot of noise, no matter who's the president, no matter what's going on. But access to care, cost of care, and dying on hold because Cigna says no is the absolute peak frustration of the American consumer. It is unilaterally across the board. No one cares who you voted for. You didn't vote for this. And it's very telling that we're now seeing a surge in new narrative. Our friend John Nosta has a book coming out too.
That's right.
That are all touching on the same Venn diagram, which is that I don't think it's broken. I think it's working the way it's working by design, and we have to break it ourselves.
There you have it, folks. And Matthew, thank you so much for joining me again. What a great end to an amazing program, speaking with just an amazing person. Thank you.
So it's wethepatientsbook.com.
And that wraps another compelling conversation here on Health Unabashed. A sincere thank you to our global audience for joining us, and to Matthew Zachary for sharing his journey, his perspective, and his unwavering commitment to elevating the patient's voice in American healthcare. Matthew reminds us that transforming healthcare isn't simply about innovation or disruption. It's about restoring agency, transparency, and dignity to the people navigating it every day. Health Unabashed streams live on Healthcare Now Radio Monday through Friday at 10:30 a.m., 6:30 p.m., and 2:30 a.m. Eastern. That's 7:30 a.m., 3:30 p.m., and 11:30 p.m. Pacific. Want to stay connected? Follow Matthew at Matthew Zachary. Follow Gil at Gil_Bash. Follow me at Greg Masters MPH, and that's Greg with 2 G's. Do share your thoughts, tagging Health Unabashed. Until next time, keep listening, keep learning, and keep raising your voice with no apologies.